Hello everyone. Today we are going to learn anti-diabetic drugs from medicinal chemistry. By the end of this video, you will be able to understand and remember anti-diabetic drugs easily. So let's start with the basic introduction for diabetes mellitus. Diabetes mellitus is a chronic metabolic disorder characterized by hyperglycemia, which means increased blood sugar level. The common symptoms includes polytipsia, that is excessive thirst, polyphagia, that is excessive hunger, and polyuria means excessive urination. These symptoms mainly occur due to lack of insulin or improper insulin action. If diabetes is not properly controlled, it can lead to serious long-term complications. Microvascular complications like retinopathy, nephropathy, and neuropathy. Macrovascular complications include atherosclerosis, which affects major blood vessels. Types. Diabetes mellitus is mainly classified into two types, that is type 1 diabetes and type 2 diabetes. Type 1 diabetes is also called insulin dependent diabetes mellitus, which usually occurs in children. Type 1 diabetes occurs due to complete absence of insulin, that is pancreatic beta cells are destroyed, so there is no insulin secretion. Treatments includes insulin injection. Type 2 diabetes is also called non-insulin dependent diabetes mellitus, which usually occurs in adults. Type 2 diabetes occurs due to insulin resistance or reduced insulin secretion. Most oral anti-diabetic drugs are used in type 2 diabetes. Anti-diabetic drugs. Anti-diabetic drugs are the agents used in the treatment of diabetes mellitus. They help to reduce blood glucose level in patients suffering from hyperglycemia. These drugs are also called anti-hyperglycemic agents. Insulin. Insulin is a peptide hormone secreted by the beta cells of the pancreas. It was discovered in 1921. Insulin regulates the carbohydrate metabolism by decreasing gluconeogenesis and increasing glucose uptake by tissues. In the body, insulin is synthesized as preproinsulin, which is converted into proinsulin and finally into active insulin along with C-peptide. Insulin physiologically increase the glucose uptake in muscles and fat, and then increase glucagon synthesis and then decrease hepatic gluconeogenesis. Structure of insulin. Insulin is a polypeptide hormone with a molecular weight about 6000 Dalton. It consists of two chains, chain A with 21 amino acids and chain B with 30 amino acids. Both the chains are connected by two disulfide bonds. Sources of insulin. It can be obtained from bovine and porcine sources, but nowadays recombinant human insulin is commonly used because it is safer and more effective. Here this slide shows the structure of insulin. As I discussed earlier, it contains two chains, that is chain A and chain B. Both the chains are linked by two disulfide bonds, and chain A having 21 amino acids and chain B having 30 amino acids. Insulin preparations. Insulin preparations are classified based on their onset and duration of action. Rapid acting insulin start working within 15 minutes, such as insulin aspart and insulin lispro. Short acting insulin, also called regular insulin, start working within 30 to 60 minutes. Example, Humulin R. Intermediate acting insulin like NPH insulin has a longer duration and it is often combined with a short acting insulin. Long acting insulin such as insulin glargine and insulin detemmer, which provides a steady insulin level for many hours. Ultra long acting insulin like insulin deglutec have a very long duration of action. Then biphasic insulin, which contain mixture of two different insulin types to provide both immediate and prolonged effect. Example, Humalog mix. Oral anti-diabetic drugs. Apart from insulin, several oral anti-diabetic drugs are used mainly in type 2 diabetes. The classification of oral hypoglycemic agents. Sulfonylureas. In this first generation sulfonylureas, chlorpropamide, tolbutamide, acetohexamide. Second generation sulfonylureas, glibenclamide, glipizide, gliburide. Third generation sulfonylureas, glimepiride. And then biguanides includes penformin, metformin and butformin. Thiazolidinediones, pioglitazone and rosiglitazone. Meglitinides, rapaglinide, nitriglinide. Glucosidase inhibitors, agarbose, voglibose. Sulfonylureas. One of the most important class is sulfonylureas, which we will now discuss in details. Sulfonylureas are the first class of oral hypoglycemic agents used for the treatment of hyperglycemia. They are also called insulin secretagogue because they stimulate insulin release from pancreatic beta cells. Mechanism of action of sulfonylureas. They stimulate insulin release from pancreatic beta cell by closing ATP sensitive potassium channel. This causes opening of voltage gated calcium channel and increases the intracellular calcium ions, which leads to release of insulin and which increases the blood insulin levels. Chlorpropamide. Chlorpropamide is a sulfonylurea. It is more resistant to metabolism than tolbutamide. So it has a longer duration of action and it is used as an oral hypoglycemic agent in type 2 diabetes. Tolbutamide. Tolbutamide is the least potent and short-acting sulfonylurea. It is safer in elderly patients and in patients who are prone to hypoglycemia. This slide shows the chemical synthesis of tolbutamide. In this, paratoluene sulfonamide reacting with ethyl chloroformate, it will give tolbutamide. Then glipizide. It is a second generation sulfonylurea and it has a quick onset of action and it is used as an oral hypoglycemic agent for the treatment of type 2 diabetes. Then glimepiride. Glimepiride is a third generation sulfonylurea. It is long acting and highly potent. So it is effective at lower dose. It is commonly used in type 2 diabetes. This completes our discussion on anti-diabetic drugs. I hope this explanation helped you to understand the topic clearly. Thank you for watching.